Sometimes it's too much, other times it's too little. Our next guest can help you get it just right. Please welcome Richard and Dana LeConey with the Institute of Anti-Aging and their patient, Caroline Greaser. Good morning. So earlier we were talking about facelifts, and there are times when that's what you need to do.
That's absolutely true, and sometimes patients come to us, and we offer services that are less invasive for kind of an in-between state, or someone who just needs a little tweaking, a little more height in the cheek, you know. And so, but if someone comes and they really are, you know, outside that envelope, I'd always recommend that they go ahead and seek a plastic surgical consult for a more definitive treatment.
Yeah.
But you can buy a lot of time with these treatments.
Yeah, and there's always something coming online. This new thing is called Kybella.
Kybella. It's really a revolutionary new treatment. It's been in development for a long time, but what it, for the first time, enables us to selectively remove fat, in this case, the area under your chin. So people who have this little bag, little sag under the chin, and, you know, maybe it wasn't enough for them to really consider going to see a plastic surgeon for, but it still bothered them. This treatment can selectively destroy that fat permanently.
Wow.
It's permanent. You know, it goes away for good. And
can I take some home? All right. So yeah, we're looking at these pictures here. Yeah, and it's like these subtle changes that make really big differences here. So it's almost like sculpting. So how does it work?
It is sculpting.
Okay.
That's exactly what it is. You know, if you just need a little bit more definition under the chin to make your jawline stand out a little better, to give that angle that's very, very flattering, this material, we can inject it there. It only takes about 3 or 4 weeks before it just completely dissolves that fat and actually causes the skin to tighten some.
And that's what I was going to ask you next, because sometimes we can remove fat, but the skin continues to hang, so that's been a problem.
Within a certain envelope, yes. I mean, we still obviously refer people for formal, you know, neck lift if they really need it. But this will be acceptable for, you know, this particular case is perfect for that, you know. And it gives a little snugging, too.
All right, Caroline, so you were looking in the mirror and you were like not liking that right there.
Exactly.
Okay, what other things had you considered?
Well, I'd looked at, you know, the possibility of plastic surgery, but I've been going to Dr. LeConey for the last 10 years, and, you know, I came to him and asked him what are some different options.
Right.
And this is one that he recommended to me, and so I was very excited to try that.
And interesting, because Dana, 10 years ago, that wasn't available.
Exactly.
For us.
No.
Yeah.
Now with this and our skin tightening lasers, I mean, you can do this.
Yeah, just do this
in the afternoon.
Yeah, do it in the afternoon
Right.
and be with your girlfriends.
Right.
Yeah, okay, so let's go through the process here.
Right. Okay. Well, you know, let me hand me the Kybella, please, right? And this is the product right here. And we filled this syringe with Kybella. It uses a very micro-fine little needle. And what we've done, as you can see, there's little dots here. That marks a grid so that we basically place a little bit of the material under the skin right at every dot. And that ensures that the material is evenly distributed.
Okay.
So it creates a nice, even, you know, appearance once the material starts to work.
And how long did you say it takes before you really start seeing the...
It will puff out initially, and then about 4 to 6 weeks is when it's like the healing of a bruise. So in a sense, I use that analogy all the time. You know, how long does it take a bruise? It gets a little sore for a while, and then it contracts and goes away.
Wow.
So I'll just demonstrate a couple. This is as simple. This is all it is. Okay. It's literally as easy as giving Botox. I just inject a little bit. This needle is so fine that even without numbing, it's virtually imperceptible.
Yeah.
This needle was developed to help juvenile or child diabetics tolerate their shots.
Okay.
And it's super microfine, polished. It's 32 gauge. It doesn't mean much to people, but it's like an eyelash.
Wow.
It's as thick as an eyelash.
Yeah, but let me tell you, for vanity, I don't care if it's as thick as a baseball bat. I'm going down. I'm taking it.
Well, we try to do everything to make it a little better than a baseball bat.
All right. So there are times we want things to go away, and then there are times we want things to fill out.
Absolutely.
And so, again, fillers have been around for quite some time. We've had some changes in terms of different types that are available as well that may last a little bit longer.
Right.
So it's just knowing where to put certain things. Smile lines are a popular place where we have issues. And, of course, the padding of the cheek. Because as we get a little bit older, we have what we call kind of that wasting where we kind of lose our volume in our face, Dr. LeConey.
That's the one.
There
All right.
you go.
So the first thing I'm going to do here is put my glasses on for this. Thank you. There we go. Now, oh, yes, there you are. So what we're going to do here is to try to improve the overall shape of the face. You know, the heart-shaped face, or a tapering chin with maximum width right here at the cheek, with a nice, full, generous-looking face. Exactly. You know, the apple of the cheek. So what we're going to do is, you know, put a little bit right here. We've already done that, so you can see that this cheek is a little bit rounder. I'm going to bring it up just a little bit more, and then we'll be able to compare side to side. So this takes just a little puncture right here.
Okay.
Gauze pad, please.
All right, that was quick.
And then, this is how easy this is.
Yeah, what you had was a little bit of numbing cream right there.
Right.
Right.
So I can just take, now this is actually I'll show you that this is a sterile glove. This is dull. It's not a sharp needle. So it will not bruise as I pass it. It just pushes the fat away. And by the way, I'm down in a layer under the skin where there's really virtually no nerves. So I can do this, and the patient feels a little crackling, but it's almost imperceptible.
Yeah.
And
so
then
you're putting
I
padding
inject.
in there, if you will.
Right.
And then what kind of substance is this? Is it something that the body obviously tolerates?
This is brand new Juvederm Voluma, which is the longest lasting HA filler on the market. And it lasts for 2+ years.
Wow.
And she doesn't feel this. I know it looks funny, but, you know, she does not feel this. This is down in the sub-Q, underneath the skin. There's no nerves down there. There are no nerves. I mean, it's virtually.
Yeah, and that plumps that skin up. And then, of course, Dana,
and basically, I just add volume to the cheek to give that apple back.
And we can also fill in like the marionette lines.
Marionette lines, all
lips.
kinds of things.
And then, of course, they'll stand by Botox to stop her from making those facial motions.
And we have a before picture of Caroline before she had any of these procedures done. Yeah.
Another picture
she's
here.
She's had filler under the eyes and her lips, and she looks 10 years younger.
The idea here is I'm doing this cheek so you can compare
Caroline.
there you go.
left
There's
to
Caroline.
right.
Yeah.
And
So she's been doing this for years, and this is just like a little maintenance
I tap it
treatment.
a little bit just to kind of distract.
Yeah. And let me just say
That's-
this, too. She has really pretty skin. One thing that you
Beautiful
guys
skin.
do is you start with
It's always nice to have a good model.
good skin. And you can get us there no matter what issues we're having with our
That's
skin,
right.
if you got some acne issues or whatever.
Between hydrafacials, the lasers.
Yeah.
Yeah.
If you will, just if you can get a close-up here, you can see that, you know, we've got a much rounder, fuller, youthful cheek.
Yeah.
And yet it still looks natural.
All right, that looks awesome. Yeah, especially when people lose a lot of weight. The first to go for me is my face.
Right.
That's why I haven't lost a lot of weight yet, because I don't want to. You know.
So that's the idea.
But now we know what to do. All right. The Institute of Anti-Aging is having an open house. It's on September 16th from 3 to 6 p.m. You can see demonstrations on Coolsculpting and Bella Shape, all the things that they offer there. The latest in freezing fat and cellulite reduction as well. They also have specials going on right now for Kybella, what you just saw in terms of getting rid of that fat under the neck and that loose neck, Botox and facial fillers. For more information and to schedule your appointment, call 713-807-1000, 713-807-1000, or log on to antiageinstitute.com.